Contraception. With a variety of methods available, many people are able to avoid unintended pregnancies. But what happens when things don't go quite as planned? Thanks to modern science, a second chance is possible. So how does emergency contraception or Plan B work? And what exactly is happening inside the female body? During the female menstrual cycle, many hormones are released, beginning a chain reaction. The pituitary gland in the brain releases FSH, which stimulates the growth of follicles and a premature egg in the ovaries. These follicles then release estrogen, which helps prepare the uterus lining and triggers the brain to release luteinizing hormone, or LH. LH then triggers ovulation, in which the egg is released into the fallopian tubes, where it will spend around 12 to 24 hours waiting to be fertilized. If the egg isn't fertilized in this time, it begins to dissolve and is shed away with the uterine lining during menstruation. Though this window of opportunity is brief, it's increased by the fact that sperm can live for up to 5 days, so the keen sperm from days ago show up early to the show, anxiously awaiting ovulation. Birth control pills taken on a regular basis modify these hormone levels. By increasing progestin levels, the body thinks it's already released an egg or already pregnant. It effectively decreases FSH and LH and the cycle halts. But in the case of emergency contraception, which is only taken if regular contraception methods fail, a few different mechanisms take place. The most important thing to understand is that fertilization doesn't happen immediately or even within hours after intercourse. Instead, the sperm must undergo a few biological changes in the fallopian tube first, which takes time. This is why emergency contraception is still possible the morning after, and can actually work up to 5 days after intercourse. If taken during the first half of the menstrual cycle, emergency contraception works specifically to prevent ovulation. This way, the egg is not released even though it may be ready and the available sperm cannot fertilize it. In cases where it's too late to inhibit ovulation, emergency contraception is thought to also thicken cervical mucus, trapping sperm. As well, it may directly inhibit fertilization between sperm and egg. Clinical studies show that emergency contraception prevents pregnancy before fertilization. No studies have shown an effect from emergency contraception if fertilization has already occurred. It does not stop implantation from happening, nor does it have any effect after implantation has occurred. In this way, it's unable to cause an abortion. And while there are some minor side effects to these drugs, such as nausea and headaches, scientific studies have demonstrated its safety in women of all ages and found that the benefits far outweigh any risks.